Have you ever wondered how Churchill's wartime government drastically reshaped Britain's social and economic landscape? In the throes of World War II, Britain was led by a man who has since become synonymous with steadfast resilience and indomitable spirit. Winston Churchill, a figure whose name echoes through the halls of history, was not just a wartime prime minister, but a visionary who, even amidst the chaos of war, strived to improve the welfare of the British people. The context of Churchill's wartime government was one of turbulence and uncertainty. Britain was in the grip of a global conflict, its future hanging in the balance. Yet Churchill's government did not merely focus on the war effort. It aimed to reshape the nation's social and economic fabric, to build a stronger, better Britain for its people. The main focus of this video is to explore the sweeping social and economic reforms initiated by Churchill's government. These reforms were not just about immediate survival, but a long-term vision for the nation. As the bombs rained down on cities and towns, Churchill and his team were planning for a brighter future, a future where the welfare of every citizen mattered, a future that promised equality and prosperity for all. Among the key reforms were the implementation of the Beveridge Report and the establishment of the National Health Service. These measures were not merely about providing immediate relief, but were geared towards creating a robust social safety net that would ensure the well-being of the British people for generations to come. The Beveridge Report, named after its architect, Sir William Beveridge, outlined a comprehensive system of social insurance aimed at eradicating what Beveridge called the five giants: want, disease, ignorance, squalor, and idleness. The National Health Service, on the other hand, was a revolutionary institution that promised free healthcare for all, a concept that was groundbreaking at the time. Such were the ambitions of Churchill's wartime government, a government that dared to dream of a better future even in the darkest hours. So buckle up, history enthusiasts, as we delve into the transformative era of Churchill's leadership. Join us as we delve into the transformative era of Churchill's leadership. Amidst the turmoil of World War II, the Beveridge Report emerged, promising a brighter future for the British people. Spearheaded by economist and social reformer William Beveridge, the report was a comprehensive examination of the British social insurance system. Its objective was clear: to make proposals for post-war social reforms that would address what Beveridge identified as the five giant evils of society: want, disease, ignorance, squalor, and idleness. The report was an ambitious plan to ensure that everyone in Britain, regardless of their social status or circumstance, would be provided with the basic essentials for a decent life. These included a minimum income level to combat want, a comprehensive health service to tackle disease, universal education to fight ignorance, adequate housing to eradicate squalor, and full employment to eliminate idleness. Beveridge's report was a radical departure from the prevailing laissez-faire attitude towards welfare. It proposed a more active role for the state in ensuring the well-being of its citizens. It was a vision of a society where poverty was not an inevitable fate, but a problem that could be solved through coordinated action and policy. The Beveridge Report was met with an overwhelmingly positive response from the British public. It was seen as a blueprint for a better Britain, a plan that offered hope and optimism during a time of great uncertainty and hardship. Its influence stretched beyond the borders of Britain, inspiring similar social reforms in other countries. The report's impact on policymaking was profound. It laid the foundation for the creation of the welfare state in Britain, leading to the establishment of the National Health Service, among other social security measures. It marked a turning point in British social policy, shifting the focus from individual responsibility to collective welfare. The Beveridge Report was a beacon of hope, a promise of a better Britain, even in the darkest of times. The Beveridge Report was not merely a document, it was a call to action that Churchill's government answered. It was a blueprint for sweeping social and economic reforms that aimed to alleviate the hardships of the British people during a time of war and transform Britain into a welfare state. Under Churchill's leadership, the government took the first steps towards implementing the Beveridge Report. They launched a series of reforms that touched every aspect of British society. From education and housing to employment and healthcare, the government was determined to uplift the living standards of every Briton. One of the key reforms was the introduction of comprehensive social insurance. This was a radical departure from the patchwork of assistance programs that existed before. It provided a safety net for all citizens, protecting them from the 5 giants outlined in the Beveridge Report: want, disease, ignorance, squalor, and idleness. Everyone, regardless of their income or social standing, was now entitled to benefits such as unemployment and sickness pay. In tandem with this, the government also initiated significant changes in the education system. The Education Act of 1944 made education free and compulsory for all children up to the age of 15. It was a move that not only aimed to eradicate ignorance, one of Beveridge's giants, but also to create a more equitable society. The implementation of the Beveridge Report was not without its challenges. It required a great deal of political will and administrative effort, but Churchill's government persevered, driven by their commitment to the welfare of the British people. The impact of these reforms was profound. They not only provided immediate relief to the war-weary population, but also laid the foundations for a more inclusive and prosperous Britain. They were instrumental in reducing poverty, improving health outcomes, and enhancing social mobility. Through the implementation of the Beveridge Report, Churchill's government began a social and economic transformation of Britain. It was a testament to Churchill's dedication to improving the welfare of the British people amidst the chaos of war. One of the most significant outcomes of the Beveridge Report was the establishment of the National Health Service. This monumental institution, better known as the NHS, was born from a desire to provide comprehensive healthcare for all, free at the point of delivery, regardless of a person's ability to pay. The National Health Service was established in July 1948, under Clement Attlee's Labour government. However, the groundwork for this revolutionary service was laid during Churchill's wartime administration. The Beveridge Report, which highlighted the need for a comprehensive social insurance system, served as the blueprint for the NHS. The idea behind the NHS was simple yet transformative. Instead of individuals bearing the financial burden of their healthcare, the costs would be shared among the entire population through a system of taxation. This meant that everyone, regardless of their income or social status, had access to the same level of care. It was a bold move towards social equality in healthcare, a concept that was groundbreaking at the time. The impact of the NHS on British society was profound. For the first time, millions of people had access to healthcare services that were previously out of their reach. It was a game changer, bringing about a marked improvement in the nation's health and longevity. Churchill's government played a crucial role in laying the groundwork for the NHS. Despite the chaos and uncertainty of war, they showed an unwavering commitment to social reform. They recognized the need for a system that would protect the health of the nation and ensure that no one was left behind in times of sickness. The NHS, over the years, has become a cornerstone of British society. It's more than just a health service, it's a symbol of social solidarity, embodying the principle that healthcare is a right, not a privilege. The National Health Service, a symbol of social reform, stands as a testament to Churchill's government's commitment to improving the welfare of the British people. The legacy of the NHS continues to resonate, reflecting the vision of a government that dared to imagine a fairer, healthier society for all. The Churchill era was not just about wartime strategies, it was a time of profound social and economic change. This statement encapsulates the heart of our exploration today. A journey that took us through the labyrinth of policies, decisions, and actions that defined the Churchill wartime government. We began by probing the Churchill wartime government, a period marked by strategic maneuvering on the battlefield, and also by significant social and economic reforms. These changes, though less heralded than the military victories, were just as pivotal in shaping Britain's future. Then we delved into the Beveridge Report. An ambitious blueprint for a comprehensive system of social security, it was an audacious plan that aimed to alleviate poverty and provide a safety net for the British people. Implementing the Beveridge Report wasn't just about putting policies on paper, it was about bringing them to life in a society that was grappling with the chaos of war. Next, we explored the establishment of the National Health Service, NHS. This was perhaps one of the most transformative reforms of the Churchill wartime government. The NHS was more than just a healthcare system. It was a symbol of Churchill's commitment to improving the welfare of the British people. It was a testament to his belief that every citizen, regardless of their economic status, deserved access to quality healthcare. As we reflect on these key points, we realize the lasting impact of the reforms initiated by Churchill's wartime government. They were not mere policy changes. They were transformative shifts that altered the social and economic landscape of Britain. They were the embodiment of Churchill's unyielding commitment to the welfare of his people, even in the midst of a devastating war. Churchill's wartime government left a legacy of social and economic reforms that reshaped Britain, demonstrating that even in times of crisis, progress is possible. A lesson as relevant today as it was then, a testament to the indomitable spirit of humanity, and a reminder of the power of leadership in driving social and economic change.